Good morning everybody, Nina Marnie. Welcome to the virtual launch of the SA Heaps Unfair report. This is a joint report from the South Australian Council of Social Services, SACOS, and the Southgate at Flinders University. I want to start by acknowledging that I'm on the unceded lands of the Kaurna people. I want to pay my respects to their elders past, present and emerging, and I'd also like to acknowledge all the Aboriginal and Torres Strait Islander people who may watch this video in the future. Of course, this launch is virtual because of the COVID-19 crisis. But you know, it's all the more important that we look at the recommendations and findings of this report because inequities are shining out in this epidemic, and they will be a crucial part of the response. We'll be responding to those. Online, and we will give you at the end of this the link to a summary, final and statistical report, and also you can find it on the Southgate website. The project was started when we became very concerned that about the data on growing inequities that John Glover and his colleagues at the Public Health Information and Development Unit were producing. The good news is that life expectancy has continued to grow for all groups, but the gradient in premature deaths between groups is increasing. How health is distributed in our state is becoming less fair, and people living in better off areas are living longer than those in less well-off areas. This has always been the case, of course, but in the last 30 years, things have been becoming steadily more unfair. And now, the most socio-economic disadvantaged areas in South Australia experience twice the rate of premature death than the most well-off areas. Now, our report has explored why the gradient of health inequities has increased. We've done this based on interviews with key policy actors who know South Australia well, and also a World Cafe workshop with participants from government, community organisations and universities that has helped us refine our findings and also our recommendations. We found 5 key crucial themes that might explain why health inequities are increasing. First of all, the deindustrialisation and changes to work. That includes the loss of manufacturing jobs, Holden, Mitsubishi and all the associated industries. Gig economy jobs are growing, incomes have been stagnating, and up until the COVID-19 crisis, a freezing of government allowances, such as the Job Seekers Allowance. There's also been widespread privatisation in education, health, public infrastructure and the housing sectors. There has been a decrease in the amount of public housing available. We used to have an SA housing trust that provided a much higher proportion of housing, and there's been an increase in living costs like rent and energy, and of course increases in income and wealth inequities. We've also noted as our fourth trend, our fourth theme, that there's been a politicisation and hollowing out of the state and federal public sector capacity. There have been many cutbacks, there have been outsourcing that mean that our public sector is weaker than it was and less able to develop policies that would be designed to reduce inequities. The market generally doesn't do that. And then finally, the fifth theme is a more general erosion of democratic social justice that we've observed. And this has included a disinvestment in community-based approaches to health and education. It's shown by the rising tide of individualism rather than the values of solidarity and collectivism. It's shown by more consumerism. It's shown by the competitive tendering that pitches NGOs against one another, and in the wind back of the use of community development strategies. For example, community health centres used to do a lot of community development and they no longer exist. NGOs are also having to compete for funding, and often the nature of government contracts restricts their ability to do advocacy. So that's our 5 themes. We've also made a series of recommendations, and these are much more relevant as COVID-19 hits us. Ross Womersley will be expanding in those a little later in this video, but I just want to talk to one. Our community health centres were cut, and the state government has withdrawn from much primary health care. And I just want you to imagine what our response to the virus could have been if those centres were still open. They could have acted as COVID-19 local response centres for testing, information and help with screening. And they could have been a point of contact for people who are concerned about their health. So our recommendations stress the importance of a strong public service. That's absolutely crucial, and Ross will tell you more about those. And finally, just to say, reducing health inequities requires us to put the emphasis on our collective well-being, to strengthen our public sectors and ensure that government decisions are made on the basis of what impact they will have on health inequities. This is always true, but certainly more true than ever as we join together to fight the COVID-19 crisis. I just want to remind you that you can follow our launch, our virtual launch on Twitter on the hashtag #SAHeapsUnfair. That's hashtag #SAHeapsUnfair. So please join us in the Twitter Fest and please download copies of our reports. Thank you very much and good morning everybody.